Finally, let's talk about the applications of the knowledge in immune signaling and response pathways in disease management. The pharmacology of drugs used in the management of HIV is actually one of the examples of how scientists exploited their knowledge of how the virus attacks the CD4 T cell, and here are some of the examples. Of course, the first step in the infection is the entry of the virus through the CD4 and CCR5 receptors. An example of CCR5 receptor antagonist is maraviroc. Fusion into your CD4 T cell is blocked by enfovirtide. In fusion and coating, the virus needs to be reverse transcribed into a double-stranded DNA via your reverse transcriptase enzymes, and this is blocked by agents such as the following. Altegravir binds integrase, a viral enzyme essential to the replication of HIV-1 and HIV-2. By doing so, it inhibits strand transfer, the third and final step of provirus integration, thus interfering with the integration of reverse transcribed HIV DNA into the chromosome of host cells. Meanwhile, these drugs inhibit the maturation of the virus. Another application is the proposed use of BCG in type 1 diabetes mellitus. As we all know, type 1 diabetes mellitus is a chronic autoimmune disease resulting in severe loss of pancreatic beta cells due to targeting of the islet cell autoantigen. An individual HLA variant influences the peptide binding and signal transduction after T cell receptor engagement. HLA, or the human leukocyte antigen system or complex, is a gene complex encoding the major histocompatibility complex proteins in humans. These cell surface proteins are responsible for the regulation of the immune system in humans. Now let's talk about how BCG vaccine may help in this problem. BCG vaccine is developed for tuberculosis protection, and it is an attenuated version of the virulent Mycobacterium bovis. So, what it does, it helps in this situation in two ways. And the first step is by inducing TNF, or your tumor necrosis factor. This is a pro-inflammatory cytokine expressed by activated macrophages and lymphocytes that induce diverse cellular responses. And what it does is it triggers apoptotic response on the autoreactive T cells, and thus it also induces the regulatory T cells expansion. And the second way, as mentioned, is by upregulating your regulatory T cells. You see, after BCG vaccinations, the regulatory T cell signature genes are demethylated in vivo, resulting in enhanced mRNA expansion. This drawing illustrates how the T effector cells help the T regulatory cells control themselves. Pathogenic T cells infiltrate and inflame the tissue. The effectory cells produce inflammatory cytokines such as TNF alpha that can act on the regulatory T cells to promote their proliferation and expansion. Your regulatory T cells can now outcompete the effectory T cells and also secrete anti-inflammatory cytokines that will hamper the proliferation of the T effector cells. The decreased proliferation of T effector cells will limit ongoing inflammation. Now, although theoretically BCG vaccine is a strong alternative candidate for type 1 diabetes mellitus, there are still a lot of questions asked. The importance of BCG dose, BCG strain, and timing of BCG administration were cited as critical for murine autoimmune disease reversal and maybe even early signs of efficacy or failed efficacy in human type 1 diabetes. In clinical trials, this theory does not also show to be that effective, although there is still one continuing clinical trial on this, and others have been discontinued due to ethical reasons. The past 10 years have seen a surge of clinical trials that reintroduce BCG for a diversity of autoimmune, allergic, and induced adaptive immune responses to childhood infections. In type 1 diabetes, three BCG vaccines administered in childhood lowered the incidence of type 1 diabetes mellitus. In a phase 1 trial with multi-dosing BCG in long-term type 1 diabetes, promising biomarker responses such as increased beneficial T regulatory cells and transient restoration of small amounts of pancreatic insulin were observed. At the end of the 20-week trial, the established clinical marker for disease reversal, lowered hemoglobin A1C, was not observed. BCG vaccination confers a survival advantage in low birth weight infants against mortality from a diversity of infections, which are unrelated to tuberculosis. Now that ends our discussion on immune signaling. Thank you for listening, and I hope you enjoyed and